brought to you by the Dao Health.
This is Delve, a podcast that endeavours to enlighten and support you in understanding and transforming your own health.
Hello, my name is Elizabeth Cullen and my co-hosts are Clarice Berry and Molly Burton. And together we will be drawing on the Dao Health's signature and unique integrative approach to traditional Chinese medicine.
So take a seat at our table, grab a tea, and let's dive deep into the enduring legacy and evolution of medical practices over time.
This episode of Delve is proudly brought to you by Born Ready. Born Ready program has been designed by women's health physiotherapists for women and their partners who want to understand the details of labour and birth and arm themselves with practical skills for the big day. Born Ready is a hybrid program with many short online modules. The practical skills section can be accessed online or face-to-face at one of our 2-hour workshops, which are run at various clinics around the country and soon to be the world. Thank you so much to Born Ready for making this episode of Delve possible. Hello and welcome back to the Delve podcast by the Dao Health. I am joined with my fabulous co-hosts Clarice and Molly. Hi ladies.
Hello, Liz.
Hello. So today we are diving into all things birth preparation and why acupuncture should be considered to best prepare for birth. To set the tone, let's start with around the table. What is an affirmation or resource you recommend for patients as part of their birth preparation treatments? Clarice, let's begin with you.
Okay, so lately I've been playing a new meditation teacher on Insight Timer. Her name's Liza Kolpler.
Love her.
We love her.
Yes.
I really like her meditation style. She does a lot of breath work at the beginning of her meditations and she plays a lot of water sounds in the background. So I find she's got beautiful meditations on all sorts of different topics, from anxiety and stress to feeling overwhelmed, if you're wanting to invite in abundance or positive morning energy. She's got so many.
What's that beautiful one that you put on when I had a treatment with you a few weeks ago?
Ooh, that one was a good 15-minute one.
Yeah.
And it was manifesting a fearless life.
Oh, stunning.
Yeah,
that was
love that one.
incredible. Like very loyal to Sarah Blondin, of
We
course.
love Sarah
We love
Blondin.
Sarah, but Liza, I'll tell you what, she's great.
Yeah,
Doing
she's
good
good.
right in the clinic.
Yeah, she is. Molly, how about you?
One of the things I like to recommend to my patients is actually another podcast called Welcome to the Womb. So there's a really fabulous episode on types of pain relief. So this is educating both the female and the male or the partner, birth partner, on the options that you have. So I think it's a really great, simple way unpack the different types of pain relief. So I love that one. And there's also another episode on that series as to what to put in your hospital bag.
Oh, I love that.
Oh, that's fun.
From midwife herself and knowing, seeing it all, seeing people bring in all the things into the hospital, all the suitcases. So it's a really practical, great episode that I really love to recommend.
Yeah,
Cool.
great. One of my favourite recommendations is Rhea Dempsey's book, So Birthing with
Yeah.
Confidence and Beyond the Birth Plan as well. I found they were really beneficial for my own birth prep, but also with patients I get great feedback, and Rhea Dempsey is amazing. So any podcast that you find with her, highly recommend listening to.
Ooh,
Love
okay.
Yeah. So as I said, today we're going to dive into birth preparation and the role that acupuncture plays to support an efficient labour and birth. Now, we polled our listeners and our community, and 91% of our community voted yes to using acupuncture for birth prep, with 9% voting no. So let's dive into the dynasty side of things and the history of acupuncture being used for women's health and birth. So traditional Chinese medicine has a long history of advocating that women modify their lifestyle throughout pregnancy to ensure healthy babies and efficient births. Lifestyle advice included regulating physical activity, following dietary guidelines, and maintaining a calm emotional state. An early reference to this practice exists in the records of the historian, which tells how the mother of the first emperor of the Western Zhou dynasty, 11th century to 771 BCE, refused to look upon adverse colours, hear indecent sounds, or the utterance of any arrogant words. And because of this, she gave birth to a son who achieved great things.
Oh, of course.
I wonder what the adverse colours are.
I'm like, isn't that very yang anyway?
Very
Wouldn't
yang.
you want yang?
Yeah, true. Acupuncture specifically has a rich history in pregnancy care, from ancient practices in China to modern-day treatments used to support maternal health and ease discomforts. First mentioned in the Ming Dynasty from 1368, traditional Chinese medicine literature, Chinese medicine and acupuncture have played a role in gynecology and obstetrics for thousands of years.
Yeah, I love that.
In modern history, growing evidence and clinical research has continued to increase awareness of the benefits of acupuncture during pregnancy, including the World Health Organization review and analysis of acupuncture. And this included reports of controlled clinical trials, and this was in 2002. And what this did is it actually recognized acupuncture to be an effective treatment for morning sickness, induction of labor, malposition of fetus or correction of sciatica and back pain, and showed a therapeutic effect of acupuncture, but needing further evidence for labor pain. So this really set the way for acupuncture being used in pregnancy in Australia. And we then were registered with APRA 10 years later in 2012. So it's onwards and upwards from there. Clinical research continues to grow for acupuncture for birth prep as well as for acupressure, which we're going to dive into today. Now, before we do, Clarice, you're expecting a baby in September, 25 weeks.
Yes.
Yes.
Exciting.
Now, Clarice is pregnant. I'm pregnant. I'm 29 weeks. So we're going to have Barbas very close together, which is really exciting.
Best
All the
friends.
Barbas.
All the birth prep.
So exciting. So obviously birth prep is really at the top of our minds now going into trimester 3. So Clarice, I'm really curious, what are you planning on doing for birth preparation for your first birth?
Yes. So I feel at a slight advantage being the industry that I work in and working with women, preparing them for labour. I'm like, okay, I've got a good basis of my acupressure. I'm coming in for fortnightly treatments at the moment throughout my pregnancy to support just overall well-being, help manage my sciatic pain that's driving me up the wall, which Molly's been doing wonderful treatments for, by the way. And then coming into 36 weeks, I'm going to start coming in for weekly treatments and get my weekly birth preparation acupuncture to just prepare for labour. Eating dates, I'm starting to eat those nice and early. So I'm eating like 4 at the moment, but I will increase that to 6 dates a day to help with cervical ripening coming into that labour prep time. And I've actually just signed up to do the Born Ready course.
Oh, you did?
Yeah, at the physiotherapy clinic. So I'm
Amazing.
excited to get into that, I think, beginning of August.
Yeah,
Fabulous.
Yeah.
And Liz, this is your second time preparing for birth. What did you find worked well for your first birth? And what do you think you're going to do the same, or you might change it up this time round? Anything different?
Yeah, so my birth experience was brilliant. So I had a physiological birth, and which is an unmedicated birth and a vaginal birth. So I had my daughter Harriet in the shower at the hospital, and that was in a private hospital setting as well. And how I best prepared for birth was I had weekly acupuncture throughout my first pregnancy, and I trained as if I was going into a marathon.
Yep.
So from when I started to feel better in trimester 2, that's when I started my training to increase slightly. So like I was doing swimming, Pilates, and then I was also doing strength training with weights and cardio. And so I've continued doing that this pregnancy. I think that worked really well for me for the birth, but then also for postpartum recovery as well. It just makes such a difference. I, just to preface, was doing all of that training prior to pregnancy as well. So that wasn't a shock for my body. That was a really kind of a progression to continue going. And I've got that confidence. I see an exercise physiologist, Gynaecology. She is amazing at Flow Physio Co. And she gives me that support to be like, okay, these are your limits and this is what you can do. And it takes away that fear of movement and exercise in pregnancy, because it does make such a difference. I did the Born Ready course, which was brilliant. And I think for my husband as well, and I'm really interested to see how Chris goes with the course too, because he took a lot away from that too. There's a lot of practical tips.
Practical.
I did the Labour with Love course as well, first time round, which was great. That also gave us a really good insight into what to expect with labour. I read Rhea Dempsey's books. Brilliant. Ate the dates, making sure it was 6 dates a day from 36 weeks. And I did acupuncture as well. And then What else did I do? I did it.
You did everything.
I did everything.
No wonder you
The
had a
Epino,
beautiful
are you going to do
birth.
that again?
I'm doing the Epino again.
Yeah.
Yeah. Doing the Epino again to reduce the chances of tearing as well. Harriet was obviously a big gal. She was 4.7 kilos.
Big girl.
Big girl, big healthy girl. So definitely I know that is likely that I'll have another big bubba. So mentally preparing for that, but also from a pelvic floor side of things. Oh, how could I forget? I saw a women's health physio the whole way through my first pregnancy, and I've continued to do the same with Charlotte Conlon at Flow Physio Co.
And I was just going to say, for patients who don't know what the Epino is, what's the Epino?
Oh, yeah, good call. So an Epino is somewhat like a balloon that you put into the vagina, and you do that from 36 weeks, and it just slowly, into the vagina, but more at the entrance. So like what you're doing is trying to stretch the perineum. And then what it does is you allow it to sit there for 20 minutes a day. It's actually quite uncomfortable.
Yes.
But what it did was it made an unfamiliar situation with birth that first time around as familiar as it could be, because when I felt that ring of fire when Harriet's head was coming down, I was like, I've been feeling this for like
a long
4
time.
weeks with the Epino when I was watching Harry Potter, being like, because you have to lay there for 20 minutes being like it's uncomfortable, but what it did is it prepared my body. And I think also that's a reason of why I only had a 2nd degree tear with her.
Which is amazing.
Amazing.
Love it.
So they're definitely some of the things that I did, and I'll continue doing the same. The only thing I've changed is that I've had acupuncture less frequently, but I think that's pretty typical in a second pregnancy.
Yeah, we'll pick it up again.
We're picking it up from the 34 weeks. So I now have acupuncture once a month. I've continued with that, and that honestly makes such a difference. So yeah.
Wonderful.
Cool.
Yeah. Oh, and also raspberry leaf tea capsules.
Yes.
As well from 34 weeks, and also expressing colostrum. I think that's
Wonderful.
really important too.
Yeah.
Okay. So we've both been having acupuncture throughout our pregnancies, but why is acupuncture so important to be considered as part of birth preparation, Molly?
I think it's really important because it's gonna, it's firstly it's a safe and effective treatment to support a woman and prepare the body for labour. So when we think about it from a TCM perspective, we actually with all things, we don't know why a woman goes into labour. We know that if we can create a really safe, harmonious environment, if baby feels safe, if the central nervous system is at a safe state, then baby will feel comfortable and ready to go. But when we think about it from that TCM lens, we talk about the yang activity. So the yang replaces the yin material growth. The qi flows freely. So when we're talking about Chinese medicine, our acupuncture points, we're trying to encourage free flow of qi and then thus move the blood as well. And then this allows the door of the uterus to open.
Love that.
When the qi
Love the door opening.
The lotus flower.
The qi is flowing correctly, the blood is circulating well, the heart is open. That's a big player as well.
Big one.
And baby is ready to come through the door.
Yep.
Into the world.
Into the world. So
I love that.
Yeah,
I
it's
think
beautiful.
it's that shift of coming from all that yang energy into more of that yin inward notion, as we talk about from like the Chinese medicine, coming inwards to allow things to flow, to feel a state of calm, and then we're filling up the cup from a blood perspective, ready to go push that energy out into the world.
Opening the door.
Opening the door.
Opening the door. Now, the benefits of birth preparation acupuncture from a biomedical perspective is acupuncture, once used as a series of birth preparation treatments, actually does support an efficient birth, and there's the evidence to back that. In addition, it supports the cervix to become ripened, so helps for that cervix to start to progressively dilate once in active labour as well, and it supports optimal positioning of baby. So we want baby to be in that optimal position for labour to support an efficient birth, and then also to reduce the chances of pelvic floor damage too.
Yeah.
We want to also reduce the length of labour. We don't want to go too short with labour, but ideally if we can get in between that, like, I'm not going to put a number on it because it's different for everyone. But if we can reduce that chance of labour, then that's going to also help for women to go, if they're aiming for a vaginal birth, for those optimal outcomes there. And also reducing that incidence of medical induction.
intervention.
Yeah.
Amazing.
So a 2004 study from New Zealand run by Deborah Betts. This was an observational study and 169 women received pre-birth acupuncture. And these were compared to local population rates for gestation and onset of labour. So what they looked at was the onset of labour, incidence of medical induction, length of labour, use of analgesia, and type of delivery. Interestingly, in the acupuncture group, comparing all caregivers, including midwives, GPs and specialists, there was an overall 35% reduction in the number of inductions. And for women having their first baby, this was a 43% reduction.
Amazing.
That's significant, not only statistically, but like that's almost like a third to almost a half, like insane numbers there.
Yeah.
And a 31% reduction in the epidural rate, which again, for women who are wanting to work towards an unmedicated birth or say, for example, using gas, then this is also just shows you that the stats are there. When comparing midwifery only care, there was a 32% reduction in emergency C-sections and a 9% increase in nominal vaginal births. Now, just to preface here, there was no statistical difference in the onset of early labour in those women receiving pre-birth acupuncture, and a randomised control trial was recommended.
Great stats.
So, Clarice, what does birth preparation treatment series look like at the Dao Health?
Yes, so we have patients, I advise, if I've been seeing them throughout their pregnancy, come in around 34 weeks just for your standard hour appointment, because around that time, if Bubby is not in optimal positioning for labour and birth, we can actually start breech acupuncture and moxibustion treatment. Again, moxibustion is just a heat therapy we use, and we actually give that for the patient to take home and do a 10-day moxibustion course where they will burn that little moxa stick roughly 2 to 3 centimetres away from the skin on their pinky toe. Super interesting. And I do see really good outcomes with breech moxibustion. Of course, there are some patients that we see where they might be having a really big bubby. Maybe the placental fluid's a little bit low and bub does not want to turn, but it's a really nice low risk intervention you can use.
And something to consider before an ECV. Yeah.
So then moving from there, hopefully bub has rotated down into a head down position and hopefully anterior as well. We actually start birth preparation acupuncture treatments from 36 weeks, and we'll be seeing women weekly all the way up until they go into natural labour. For some women, we might be increasing their treatments to 2 times a week when we're beyond that 40-week mark, especially if their midwives or care providers are talking about a medical induction too. We'll have a really in-depth consultation. We actually invite their husband to come around or their partner, their birth partner, to come in for that first initial appointment where we'll talk through acupressure. And so we'll teach them different points that they can press. Any points you guys want to go through on here?
We'll talk about the acupressure points because we'll talk about the research of why that's actually so important as well. Yeah. But yeah, definitely we're teaching acupressure at that 34-week appointment.
Yeah, we'll go through their birthing plan or desires, what they're hoping to get out of their birth. We'll talk about different labour preparation advice that they can do at home, which we sort of talked about earlier in this episode.
And interestingly, right, we've moved that forward to 34 weeks instead of beginning that conversation at 36 because as you heard with what Clarice and I are planning, there's a lot to it. It almost becomes like a full-time job when you add perineal massage, FNO, dates, movement, etc. and all of your appointments, that sometimes you also need that time to prep to be able to get that all ready for 36 to 37 weeks as well.
And if a woman hasn't checked in with their women's health physiotherapist, that's something I'll highlight. So having that time as well to check in, see how your pelvic floor looks, check in on your push, anything else you need to address with them, whether it's pain in whatever part of the body, then there's time to do that too before baby arrives.
Yeah. And then, of course, after our consult and we go into the in-depth nature of their pregnancy, how they're feeling, then we'll give an acupuncture treatment on the day, which is using certain points to help prepare the body for labour and birth.
Beautiful. And I guess really our principal treatment is really if the chi is correct and if the blood is circulating well, then labour is harmonious, and that's what we're working towards with that series of treatments. It's really important to note that acupuncture is accumulative, so dose is really important when it comes to birth preparation treatments. So if, for example, someone calls for a treatment at 40 weeks, we won't actually treat them for an induction treatment there. It's starting birth prep because we don't want to put the body into shock, and you will find better outcomes if you begin earlier. And the research backs that too.
Yeah. A cumulative dose will build on the points each treatment, and then depending on how the woman's feeling, will treat accordingly to them as well. So whether there's more of that anxiousness component there, they're unsure, it's their first baby, we're putting lots of heart points. If swelling's a big issue, then we'll pivot the treatment, still adding in our ripening points and our musculoskeletal points, but then supporting the fluids too. So each individual treatment is catered to the patient.
Yes.
And we do recommend accumulative treatments weekly from 34, 35, 36 best. If you're at 38 weeks, we'll still see you, but we'll build on it.
Absolutely. And so to make it very clear that we do not offer social induction acupuncture. So that's where, say, for example, if someone called and said, can you do an induction treatment? I'm 39 weeks. I am over it. It's like, no. Come in for birth prep. Let's prepare your body. And when that chi is flowing freely and harmoniously, then labour will begin spontaneously.
Yeah.
When would we offer an induction treatment, Molly?
I think it's important that firstly we preface that we're having a good shared care team around us. So depending on who the primary healthcare provider is for the patient, we will have that discussion with them openly in terms of when we may support more of the induction style treatment. This will be when a medical induction is on the cards for various reasons for patients, and we want to try our best to support the cervix to be as ripe as possible prior to that medical induction occurring, to support then the flow on of that. As we know, a medical induction can be quite a shock to the system, especially if baby isn't ready to come.
Especially for their first.
And then that can come with a cascade of intervention as well. So where we can as practitioners, we'll add in some additional points to prepare as much as possible prior to that medical induction, with their primary healthcare provider.
Yeah, absolutely. And, we're making sure that that's informed from the obstetrician, or we're seeing the yellow card from the hospital with the midwives as well. Yeah. Yeah. Okay. So, Clarice, how does birth preparation look for a C-section?
Yeah. So we still advise patients come in to prepare themselves for the process of a C-section, because it's pretty full on. I don't think a lot of patients realize what is entailed in their C-section procedure. So we'll be going through still, what does your birth plan look like? What are you doing in the morning before you get there? Have you talked to your obstetrician about when you're going in? Is your partner allowed to be there with you? Can you do skin-to-skin contact with dad after the bub's taken out? There's some great courses out there that we also recommend patients touch base with. The One Mama Midwife C-section course is fantastic.
Incredible.
And
really does pick up on those little details that you may not talk to your obstetrician about, or your midwife.
Yeah.
She's so supportive and honestly just a wealth of knowledge, isn't she?
She's great.
She's really changed the space for C-sections, I think.
Definitely.
Yeah.
It's still an empowering birth.
Yeah.
Absolutely. And birth is birth.
Yeah. And we still will be going through acupressure with you. We're going to be using different points because we're not trying to actually encourage natural labour to commence, but we're talking through acupressure points that are going to be really calming for your central nervous system, and that also that dad or your birth partner can apply for you during that C-section to keep your body as calm as possible during what can be a pretty intense procedure.
And there's a lot of waiting, there's a lot of medical people in the room, in the space, so whatever your birth partner can do to help support you and your central nervous system during that time,
Definitely. And knowing your options as well.
Definitely.
If that's something that you wanted to go ahead with an elective C-section, is do you know about maternal assisted C-sections?
Yeah.
And, does your obstetrician offer those? And those type of questions that you can ask your obstetrician, as well as are they open to delayed cord clamping, etc. So I think if we can get that body and that central nervous system into that place of harmonious balance, not only is it going to help for a smoother experience with a C-section, but also for postpartum and with breastfeeding if they intend to do so as well.
Huge, yeah.
Yeah. Okay, so let's talk about acupressure. So acupressure from a cultural perspective in Australia, I think is taken quite lightly. I think it's kind of like, if, say, for example, a birth course is like, and let's do a 5-minute segment on acupressure. I'm going to show you a few points.
Yeah.
Give it a go if you want. But there's so much evidence behind acupressure. So much, and how it can really, really benefit a woman throughout their labour and for an efficient labour and to manage pain. Now, it's low risk. It's accessible to everybody. You just need hands.
Yeah.
So whether that's your birth partner's hands or whether it's the midwife's hands, if you and your birth partner or support team are across acupressure, you can use it. So that's why we teach our patients and we make sure that they're feeling really across it. And that's why when we teach our patients and their birth partners, we're teaching them early on so that they can practice. So from 34 weeks, we'll say, okay, let's go through those points. We'll give them a handout, and that's their homework from 36 weeks is to start applying the acupressure. Not only does that support them to start to almost develop a bond in the way of like patient feedback of like, okay, that point feels good. I like that point, or that point feels really off. Can you press harder because I can't feel it? But what it also does is it builds the birth partner's confidence, because then they've got a tool to offer their partner in labour as well, which I think makes such a difference because they feel useful because often it is a time that can be overwhelming and then they step back. And then also it's going to help with that oxytocin release
Physical
in
touch.
the body as well, physical touch. So not only, and we'll jump into the reasons of why you would use acupressure, but also whether you want to use it as a placebo or not, I don't mind, but you're going to increase that oxytocin through the physical touch.
Yeah, amazing. Yeah.
So love quizzing birth partners at the end.
I do.
Appointments.
I do
that.
hear you go, quiz time.
I love it.
I love
it. Okay, it's time for the quiz. I had the most amazing birth partner come in and he brought his iPad and he wrote notes the whole time.
I love him.
Incredible. Like he is.
I do love an initial birth prep appointment. It's just
They're
such
great.
good energy. You finally get to meet the birth partner, whoever they are, after a long journey. If you have met them in that preconception phase, it's all hands on. They've got their sheet there, ready to go. It's all hands on.
And they're so keen too, because all they want to do
great.
is be part of the birthing
Okay,
experience. Yeah.
So let's
Let's
bring
do
them
it.
in. Let's
Yeah.
welcome them in. It doesn't have to
Yeah.
be something that's private and they feel excluded. Let's really empower them so they know how they can support their partner.
Yeah.
So, quiz time.
I hear it all the time. I'm like, oh no.
Oh, it's another quiz.
Yeah.
He's like stressing in there.
I'm waiting for you to be like, gold star at the end.
I need some stickers.
Yeah.
So research from 2020 suggests that acupressure for pain management during labour reported the following benefits: reduced pharmacological analgesia, less intense pain, and I think most importantly here, increased maternal satisfaction.
Yeah.
So, there is elements of labour that are out of our control. And if we can see that women feel satisfied with whichever direction that their birth actually does go in and they feel safe and heard,
That's all you
Amazing.
want.
that's all that you want, right?
Yeah.
So in the poll, 78% of our community said they knew why acupressure is beneficial in labour, although only 48% said they used acupressure in labour. So I'm really interested in these results and wonder what the barriers were for our community using acupressure. I think, interestingly, one reason is if they haven't used acupressure early on. So the research shows us that we need to use acupressure from when labour begins, is that I think if you're into the depths of active labour and you're coming into that transition period, that I think it's out the window if it hasn't been used, or because the research shows that it's more clinically effective if you use it from early on, they might not be getting much of a benefit from starting halfway through that stage one of labour. I also wonder if it's from a touch perspective as well. If a mother's just like, I don't want to be touched,
True.
it's like, okay, well, what are our other options there? So just making sure that we're really giving realistic advice to the birth partners, but also emphasising you need to start early on to be able to get that clinical benefit.
Yeah.
Did you start at home, Liz? Before?
Yes. Yeah, at home with large intestine 4, and then I was loving the 10s through the sacrum.
Beautiful.
Yeah, and then Pat and I used acupressure the whole way through, which was like brilliant.
Yeah.
And we did a
amazing.
countdown at the same time, which I'm a bit of a numbers gal, so that worked really well. So
Yeah, great.
yeah, so we did a countdown and pressed the points, and like it's so funny, right? Because the points that you prefer through labour prep can be very different to the points that you actually want to use in labour, and depending on the positions that you're labouring in.
Yeah, what's accessible.
It's accessible, and like say for example, large intestine 4, I was often labouring in the bath and doing like a rotational pelvic movement during contraction, so I found that with that distraction of large intestine System 4 is good.
And I find too, as well, feedback from patients when I see them post their birth. Pre-birth, they're doing acupressure and they're just doing like holding at that point for a minimum of 30 seconds. And it's more of that pokey sort of pressure, pointing down on a point quite firmly.
Yeah.
And then during labor, they were like, all I wanted was like physical touch and massage. So I advise patients to make it more pleasurable because pain and pleasure pathways go through the brain stem at the same point.
Yeah.
We have more creature comforts around us. So bringing in pillows you like from home, or if you like a certain scent, creating that relaxing environment, music, but also turning that physical touch part of the acupressure into more of a massage, but still giving firm holding pressure to get that physiological response. I find patients also respond well to.
Or distract with massage and then use acupressure at the same time.
Yeah.
That could also be a way to do it because obviously from a clinical perspective, you want to be using that firm pressure.
Yes.
So it's like, how could you
blend the two in?
blend the two together?
Exactly.
Some hot tips. So birth comb is a nice combination with large intestine 4, so on the heart meridian.
Love that.
As well, so pressing the birth comb in here and then you're controlling that and then the birth partner's pressing large intestine 4. Also, student midwives. So if, say, for example, you want a few acupressure points going, or say, for example, you've got your birth partner with you for emotional support up this end, let's get the student midwives involved and they can be coming down to, say, for example, spleen 6 down on the ankle as well to help ripening the cervix. Another hot tip is if intervention is introduced, don't stop your acupressure.
Yes.
So we still want the labour to be as efficient as possible. So say, for example, if you decide to have an epidural or if it's recommended, let's still use spleen 6 during those contractions as well because that's going to help you to efficiently push.
Yeah,
Definitely.
exactly.
And you can use it in concurrent with your other methods too. So whether you've got the TENS machine on the lower back, still jumping into large intestine 4 or coming into your sacral points.
Absolutely.
Together. Put it all in there.
Put it all together. It's a lovely combination. And then when I was teaching the midwives at Sutherland Hospital a few months ago, one of the midwives made a really good point. She's like, if this is so effective, why aren't we doing it? And it's like, well, I don't think it's being taught properly.
Yeah.
And I think that's a really big part of it, that it's like, well, no, we need to know how can you realistically use this to make it clinically beneficial? And then also, how great would it be if more midwives were using it?
Yeah, it'd be an amazing tool for them to use.
To reduce intervention rates.
Yeah.
Because I think, like you mentioned before with some of the birth courses, it does touch on it for a good hot 5 minutes or something.
It's
but
so
it's more
fluffy.
like, okay, here's the point, like a little touch.
Yeah, like, here we go. Just press that like
But what should it feel like, Liz?
It should be uncomfortable. So it shouldn't be
achy.
painful, but it should be uncomfortable. But also in labour, if you want it to be painful, great distraction. So not only are you using the acupressure to be able to get that clinical benefit, but it also works for distraction from pain relief side of things as well. And I remember doing the Born Ready course and it's really good. You'll love it in the way of they test how you manage pain. As well. And so you do a squat. And so you've got to sit down and see how you manage it. It might be through breath. It might be through using a distraction technique. And mine was distraction. So I think that's why that obviously worked quite well as well. And then, I just think it's one of those things where when we talk about low risk, like the only risk really involved in acupressure is bruising. So obviously you need to get consent as a midwife or a student midwife of saying, look, do you mind if I use acupressure? It could cause bruising. But in reality with childbirth, you're not really worried about a few bruises.
No. Exactly.
So,
really low risk intervention.
Low risk.
To bring in that could really help the efficacy of your labour and birth to have that physiological birth too.
Absolutely. And when we talk about that crisis of confidence between stage 1 and stage 2 of labour, Rhea Dempsey, credit to her, great saying. But when you're in that stage as well, using those points like kidney 1, do my 20, Shen Men, it's going to get you back into your body.
Yeah. When you're going, I can't do this. This is just too much. It's like, actually,
come on, let's use that grounding force of kidney 1.
Yep.
Yeah, and you can get that person back in their body. So it makes a big difference. And just circling back to spleen 6 as well, if someone is having an epidural, they're obviously going to be more at risk of bruising because they're not going to be able to feel the point as much. So with spleen 6, that's just something to flag there.
And then I always like to flag spleen 6 for placenta delivery too. So
Absolutely.
babies arrive, babies here, skin to skin, it's all happening, but then still using our acupressure point on spleen 6 to support the uterine to contract and deliver the placenta.
Absolutely.
Yep,
and large intestine 4 for those post-birth after pains as well. So
those old things.
Yeah, those all good things. So we're going to get into our Dear Dao Does segment. Now, a question from our listener today is, my birth preference is a physiological birth or with the least amount of intervention possible. What can I do best to prepare?
I always say education.
Absolutely.
And knowing your options, having all the things in your mind and in your head, and starting to educate yourself, you know, in the early stages of pregnancy, if not before you have conceived, because often when we come in for those appointments at that 34, 35 weeks, if we're giving this information, it can feel quite overwhelming. So if you stagger it across the pregnancy and slowly into being like with, you know, some maybe the birth with confidence book, or it's a podcast, or just slowly building up your bank of knowledge and your birth partner too, so that you can feel super informed and educated coming into the birth space.
Yeah.
Absolutely.
Yeah.
I think it even comes back to who you choose as your care provider.
Yes.
As well. So if you decide to go with obstetric care, making sure you're going with an OB who's going to be aligned with your preferences. I like to use the word preferences over plan, because obviously, again, there's an element of labour we can't control. But if that's what you want to work towards, then having someone on your side or on your team who's listening going, yeah, okay, let's work towards that. Obviously, we need to have our other options of what possibly could happen and what would your preferences be there, because we need to be realistic. But if that's what we're working towards, then just making sure you've got a care provider who supports that.
And of course, as mentioned before, coming in for your acupuncture throughout your pregnancy, we know that does benefit your outcomes in your birth, and coming in for those birth preparation appointments too, because it's that accumulative effect of acupuncture where we see better outcomes as well.
Absolutely. I think
Sorry, I was going to say as well, perineal massage. That's a big
perineal
player.
massage, 100%.
So
Seeing a women's health physio.
Yeah, you're engaging with the women's health physio. This is something you can do after your 20-week scan, just checking on where the position of the placenta is and how baby is tracking, and then checking in with your women's health physio for that internal assessment, and then using their skills and seeing them throughout the rest of the pregnancy, and then coming into that birth prep space where they can teach you the perineal massage, potentially engage in that epi-no that Liz was mentioning before, because that will really set up the physical space too.
And like what Molly was saying is once you're starting to feel better in trimester 2, is really you need to start planning for birth if you want to go for a physiological birth, and thinking about it in the way of a strenuous physical activity, and how would you usually prepare? So how would you prepare to do an ultra marathon? Will you be training? So you want to be as fit as you can be going into a physiological birth, because that's what's going to get you through. I remember having a discussion with Shania a few weeks ago. She's like, go to this amount of reps, but if you can do the extra ones, do it. And I was like, well, I need to do those extra ones because that's what's going to get me through labour, because that builds up my pain resilience, right?
Yeah.
Because you need to be comfortable with being uncomfortable so that you can understand with your perception of pain. Okay, pain is for purpose. So there's pain with purpose.
Yeah.
How are we going to get through it?
Yeah, and I guess as well, Liz, because this is your second time round birthing, you already you know what's going to come in terms of pain. So I guess also rewiring your brain as well in this preparation phase.
Yeah, and it's a non-negotiable that you have to prepare your body. I think that's especially like for any birth, you're going to have a better outcome. But just remembering birth is only for a day or 2 max, really. Postpartum's for a very long time. And I think that's where it's like the changes in how you look after your body throughout your pregnancy not only make a change for your birth, but also postpartum. And then central nervous system support, I think, is really important, whether that's through acupuncture, whether there's fears coming up, seeing a psychologist as well, or going to Panda Hotline or Gidget Foundation, which we'll include in the show notes. And then meditation as well. And a patient recently, she used the birth weapon balls. Have you heard of these?
The spiky ones?
Yeah, the acupressure balls.
Yeah,
I'm like, I want to
that.
try that this time.
Yeah, me too. They look fun.
really cool. And then you've got 2.
I know.
Because the birth cone was a bit,
Yeah.
you kind of a bit odd when you've only got one.
Yeah, bring them all. Bring all the tools. Yeah.
Bring them all.
The
And
weapon
then
balls.
TENS.
Weapon balls, I like that.
I don't think we've mentioned it, but TENS.
Yeah, cool.
TENS
TENS
machine.
machine,
TENS machine. Beautiful. Alrighty. So in summary, for dessert, I just want to emphasize that when you're scheduling birth preparation treatments for acupuncture, to see an APRA-registered women's health acupuncturist who is trained in women's health and pregnancy. It is so important. Ideally, of course, we recommend to have acupuncture the whole way throughout your pregnancy from when you conceive. Often we'll be seeing patients for preconception care all the way through, but just making sure you are seeing someone who's APRA-registered and not a dry needler. And I also strongly recommend not seeing an acuneedler as well. I want you to see an acupuncturist who's women's health trained, because they'll give you the best care. Now we'll talk a little bit more about those show note recommendations as well. So in addition to what we've already spoken about, there's some Dao Does journal links for supporting an efficient labour to be able to give you a little bit more insight. And then the research that we've spoken about today is also in that. We also have an acupressure online course that's accessible via our website as well.
So exciting.
Amazing.
So exciting.
So if you don't have the access to acupuncture or a TCM practitioner, you can still learn and utilize the skills of acupressure at home and during birth.
Exactly.
Labour.
Yeah.
How exciting.
Love that.
Yay. We hope you've enjoyed this episode of Delve. Thank you so much to my wonderful co-hosts, Molly and Clarice. We'll see you soon.
Thank you.
Bye.
Thank you for listening to this week's episode of Delve and being a part of our community. Follow @the Dao on Instagram to vote in our polls and stay connected. Ask our team a Dear Dao Does question via the link in our show notes. And for more information and to sign up to our newsletter, visit our website.
The content provided on this podcast is for informational and educational purposes only. It's not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of a qualified healthcare professional with any questions you may have regarding a medical condition.
Leaving a review on Delve helps others to find our show and increases awareness for women's health and traditional Chinese medicine. We would love if you can take a moment to like, subscribe, and share. This episode was recorded on Gadigal land. Always was, always will be traditional Aboriginal land.